Okay.
Kaya pa, kadali lang bima.
Streaming namin, sir.
Kaya mag-streaming sa amin. Akong ipangita tong kang LG naka-live na ka, G.
Nagpag-uwan
Kasi kinig tabi diri.
Karon
kay labay.
Ayun
Okay
sa
na?
Ilabay.
Mahal na sila dito.
10 seconds.
Sulod pa man mo na.
So di malabay sa Jessica Soho.
Usa ka base.
Dito
Asa man to, Negros Oriental.
Province. Provincial government.
Wala lagi.
Provincial government pa. Tara.
Kanya? Nga nag-ready na ka?
Oh, nana.
Wait sa ay lapit ani. I'm sa game ha. Kaya akong i-share. Live na ka, G?
Oh, nana.
Kaya akong wait sa. Dako kay ko tingog. Okay.
Okay na, ready? Sige.
Go.
Maayong gabi kanatong tanan.
Okay.
Salamat sa inyong pagsanong sa among panawagan alang sa media briefing karong gabi una. By authority of the governor, we call this very important press briefing. Gahapon, Marso 10, gihatod sa SUMC gikan sa Ace Doctors Dumaguete Hospital ang usa ka pasyente aron sa dugang atensyon medikal. Gikuhaan siya og nasopharyngeal ug oropharyngeal specimen nga gipadala didto sa RITM niadtong Marso 9. Kanihang hapon miabot ang resulta positibo sa coronavirus disease COVID-19. Tungod niining maong kalambuan, gipasalig sa atong pamuno lalawigan nga kanunay kining tagaan og dako nga pagtagad. He urged the public not to panic. The provincial government is on top of the situation. Mihangyo ang atong gobernador sa atong katilingban nga mosunod kanunay sa mga protocols o pamaagi nga gilatid sa Department of Health. Contact tracing may have started tonight with the Rural Health Unit of the LGU where he comes from. The flight manifest is now available for those who have been with him in his flight from Naiya to Dumaguete via Philippine Airlines. And we will ask the help of the Negros Oriental Police Provincial Office and the Criminal Investigation and Detection Group to contact these individuals. The provincial leadership also appeals to those concerned to please feel free to submit yourselves for medical examination in case you have manifested flu-like symptoms. For the hospitals, the governor asks you to make the necessary procedures for disinfectation of your premises. Those medical staff who have direct contact with the patient to follow the health protocols. Ang hangyo sa atong pamuno lalawigan nga magpabilin kita nga mahinahon taliwala niining bag-ong kalambuan. Atong iampo ang biktima o ang atong katilingban nga makalinggawas kita gikan sa hulga sa COVID-19. Duyog kanato karon kauban ini atong press briefing ano niya si Dr. Villamor sa DOH o si Dr. Estacion sa Provincial Epidemiology and Surveillance Unit. You're ready for questions.
Doc, magsugod na ta sa atong contact tracing ani Doc kana nang tayong nag-positive daw.
Yes.
So kana sa ta magsugod Doc.
Kaninang after I received the result from DOH, I already instructed the municipal health officer concerned where this patient came from nga mag-contact trace na ta. And then I also instructed ang iyang kauban paglakaw nila sa iyang paglakbay kung asa siya niadto. Karon pod nanay ko mga names i-text ako. So I think we will be ready on Thursday, tomorrow or Thursday, to go to the area and have our contact tracing.
Doc, since it's positive, is there a second, what do you call that? Confirmatory test?
Yes, the protocol is if the first test comes out positive, then there will be a second test that will be done 48 hours after. Mm-hmm. And then other tests until the result will be negative for two tests. Mm-hmm. So that is the protocol.
So how's the patients karon? Anybody can answer? Yeah. The patients daw. How
Pwede
is
masultira?
His condition.
Condition.
Okay. The patient now is in severe pneumonia. He is confined at the isolation room in one of the private hospital, and he is on ventilator.
coma or how's
He is in
the
ventilator.
ventilator?
Yeah. Actually, the private hospital that you are referring to is the Sliman University Medical Center, because they already put out a press release
Yes,
a
that's
while ago.
That's right.
Yes.
Now, a little concerned about this because it seems like there are marag lapses in communication between both hospitals. Are you going to look into this? Have you read that press release from the SUMC?
I called up the governor regarding that matter, and he told me and gave me instruction to inform Dr. Leland that we will have a meeting tomorrow with the administrators of these three hospitals.
Luncheon meeting.
Luncheon meeting,
Is this a cause for concern?
of course, because we need. There's a protocol that we have to follow, and I think they know the protocol. And if I would not speculate that there is a lapse, but we will ask them nganong na yun ana ang nahitabo, but I think they have their own explanations.
Were you able to read the press release
Yes,
of
I
the SUMC
did.
already?
I did.
But you still need to get the side of the ACE.
Yes,
hospital.
of course, of course.
Magkandak ba tayo ng investigation?
And that is not an investigation. Actually, we will just talk it over and basin og naalay mga misconception yun na ito.
Yeah, but during our previous press conferences and media briefings, we were under the impression that there's already in place like a protocol to follow by all of these hospitals. So how come there seems to be a lapse somewhere?
Yes, as mentioned by Mr. Bimbo Miraflor, they will still have to inquire regarding that alleged what was written in the statement of SUMC.
Okay.
So he's right. We will have to get the side of ACE Hospital also.
Okay.
So what really happened, because they are the ones that who really knew the sequence of events from ACE Hospital to SUMC.
So kay kuando gituyo na siya balik sa hospital to kuan para makalikay sila or kay dili mo gud sa magiti we understand nga mo ni naandan ba kung di sila kontento sa hospital mobalhin sila lain hospital.
So as the information I got is that it was a request of the family of the patient to be transferred to SUMC.
So that means there will be two hospitals now, with due respect to these two hospitals, that will be under, how do you call it? Of course, contact tracing and
Contact tracing,
sanitization and disinfectant and all that stuff.
Actually, they already did precautionary measures because, like in ACE Hospital, upon admission, it was already considered a PUI. So they already had their preventive measures in place, and then they, because we did a monitoring to the three hospitals 2 weeks ago regarding their protocol. So they had the protocol on how to manage the patient, and they have also this what do you call this the protocol in bringing the patient from the emergency room to the isolation room.
Doon na ba ito lubago ng ACE doctors?
I cannot speculate at this time. No.
Okay, but all of our hospitals have isolation rooms,
Yes, all of them have isolation.
and all of our hospitals are equipped with the proper equipment, the protocols, and then the medical staff to attend to patients who may have the
Okay.
COVID-19.
Based on our monitoring, the number one problem really is one is the hospital staff that will go on duty if there is a PUI or a positive case for COVID. But they are trying to answer that problem. And then the second main issue that we encountered was the availability of the PPEs for their health workers.
Sa giingon jud Doc nga protocol, kung ang sa usa ka ospital nga na doon na sila suspect na sila nga kini niya usa ka posibleng COVID kanang quad o suspected COVID patient. Unsa man pwede pa ba siyang ibalid sila sa ospital o unsa man?
Ideally, dili na ginunta na siya ibalhin, dito na lang ginunta na siya. Pero sometimes magod, with the wishes of the family, lisod sa balibaran usahay. So mao nang tingali ang nahitabo kay murag the family man ang ni kuan nga ibalhin with SUMC.
So di siguro napakyas ang doktor dito sa pagpahibalo sa taga-Siliman nga kini niya pwedeng kuan.
We will know about their reasons tomorrow.
Okay.
Doc, can you give us a background of this patient? Asa sa gikan, history of travel, o sa hindi tamo niya, Doc? Just for the record lang.
Pwede ko masulti. Okay, the patient went to Manila February 28, and then he came for a meeting in Manila, and then he stayed in a hotel in Manila, and then they went shopping in one of the malls that was identified as as there were also positive patient, and then after that they also went to SMX where the session where they had a convention, and then went home to Dumaguete March 1 morning flight via PAL.
Okay, so ang manifest yung symptoms, Doc, how many days?
So after arrival in Manila, he went back to his hometown and then attended so many, not so many gatherings, but some gatherings, and then went around the Changi and bought something, and then March 7, he consulted at ACE Medical Center. That's the time that we were alerted that there's a patient. So there was a request of a throat swab. So DOH and our person here in charge for swabbing in PHO, niato dito og gikuhaan silang swab.
It was sent to Manila.
It was sent to Manila
On the same
day, 7.
Monday.
9. Admit check 7, the swab was taken Monday. Monday, it was sent on the same day, and then this afternoon na kuha ang result.
Which is positive. Then there will be a second
Confirmatory test. After how many hours now?
48
hours
hours.
confirmatory.
So still, this is not considered a local transmission, right?
At this time, we cannot consider that as a local transmission because it could be epidemiological link, no,
To his
that
travel.
case, to his travel in somewhere in Greenwich.
But in the event, because he's apparently since he arrived, he didn't manifest symptoms yet. So we went back to his hometown and he had gone to some places, and then the symptoms came out later na. So are we prepared for a local transmission, God forbid?
Actually, that is one of the reasons why DOH declared a code red alert, and also the president declaring a nationwide public health emergency, so that all the agencies, including the LGUs, can prepare for kanang situation nga mudaghan na gyud ang atong kaso.
So you will be visiting the LGU tomorrow,
Yes.
and will you be doing the contact tracing there as well?
With DOH, even though there are people, we have no, we will start here. We will not wait for national or regional to come, but we are instructed to initiate already the contact tracing.
But they will be sending people here as well? The DOH, no need na? Region 7?
Maybe
Yeah.
we will have some monitoring with the REZO, with the regional office.
What about the people that were on the same flight with this person?
Yes, they will be considered. Depende because there is a three seats before, 3 seats after, and 3 seats within
side.
in the sides. So we'll consider that.
You have
What's the
contact
seat
with them
number?
already, Doc? You have contact with them? You have
We have the manifesto.
The seat number.
We cannot divulge.
You
that.
cannot
We cannot
divulge
divulge
that.
it.
divulge the seat
Yeah,
number.
but we can. Is there any statement for you for the passengers for them to voluntarily come out and come and see you for that?
Yes, as mentioned earlier, we appeal to those concerned who are actually in the flight with the patient to please voluntarily submit themselves to health authorities for examination if ever they manifest flu-like symptoms.
Karon Dr. William or Doc, since nga nanatay usa ka confirm mas ultimo na ito ng confirm positive case diri sa Negros Oriental. So usa may atong sunod kumaro.
So muna, ang number one will be contact tracing. That is the most important thing to do to identify the close contacts aning pasyente ha, no? And then para ma-monitor po to sila. So they will be considered as PUMs already once ma-trace to sila.
Did the patient have a history of travel to Singapore? Are you aware of that?
No.
But can you look into that?
We'll try to ask.
Sir, kami sir, kay nanin positive sir, automatic ba itong mga classes o mga lawa sir, suspended?
Not necessarily.
How about in somewhere out there? Where the
Where is that somewhere?
patient
In the north.
It is up to the local chief executive.
What about the hospitals? It's up to as you said, you're going to meet tomorrow, but it's up to them to decide, or will you be making recommendations as to will there be a partial, containment area, or which areas will be off limits to persons, etc.
It depends upon their
Own protocol. They have their own protocols also, but it should be based also on the guidelines set by the Department of Health.
Okay.
Any more?
So, sir, again sir, karon kay nanay nag-positive sir, mas mag-panic niya itong mga tao.
Yo, pod. That's what the governor appeals to the public, not to panic.
Okay.
Because the provincial government is on top of the situation. Our medical team will be going out tomorrow to contact trace these people. Katong naiman, we ask the help of the police and CIDG to contact trace. Even this afternoon, RHU has already started their contact tracing.
I would
So
just like
I know we can contain this.
I would just like to add in relation to that question nga, remember that coronavirus is transmitted by droplet, no, through droplets. So it's not airborne. So if you didn't have any close contact with that patient, then there's nothing to worry really. Oh.
Ayro gyud manghugas na gyud tag kamot.
Sir, based on the katong sa classification sa DOH, sir, sa 49 cases, kapila ni si
Ika-39.
Patient 39.
39.
Ika-39 siya sa list. He's 39.
sa quad nationwide.
Nationwide, yes.
He's 39. And in fact, in the list for validation pamanggan
No.
at the latest.
thank you for confirming.
Okay. So any more?
Quad na sir, pero mensahe na lang sa atong katawan para mo na gina, para at least ma-relax ang ilang mind kay maski kaniya sa mga post kaniya doon na upat ka POM aw 13 ka 12 aw 13 ka POM upat ka kuan uda na po ini ana ba so ini kuan sir.
Ang amo lang hangyo gikan sa provincial government nga dili lang ta maminaw sa legitimate nga agency na sources para dili ta makadugang sa paniki sa mga tao. We rest assured that we will give you verified up-to-date information. That is why right after nga nakadawat si Doc Leland sa result we talked with the governor, and even though na ay pronouncement nga until tomorrow na kay kinanglan nga kuan sa DOH, but the governor said no, we have to release the information for the good of the Negrenses. That's the governor's view actually. So muning kita karon diri, and let us amo lang hangyo na mo, let us pray all together. God knows how to end this menace actually. Doc?
So, Doc, when are we expecting the results of the second swab tests?
I just hope that because this is already a confirmed case, so they will prioritize this patient when we send the swab. Okay. You know, right now, murag daghan man jud kayo tang kaso throughout the Philippines, especially sa NCR. So, ang volume to be examined daghan yun. So, murag first come, first serve basis yung tingali na dito, except tingali ko na ay priority nga.
Like, is it because of this?
O like kung i-inform sila daan nga this one is having severe pneumonia, siguro kana i-prioritize na nila. And that was what we did, no? We called up some people sa RITM and then told them nga kung pwede ba ma-facilitate ni iyang test kay nag-manifest mo siya severe pneumonia. And then part karon sa atong kuan sa protocol po sa DOH because naa naman gyud tay mura local transmission dito sa NCR. So we will be also closely monitoring katong naay ma-admit or magpakonsulta nga with severe acute respiratory infection, no? So whether naa siya history of travel outside or wala ba or naa ba siya contact sa positive patient ngun ana. So we will be more vigilant on this.
Doc, sa atong mga makontact trace unya, Doc, kanus unahon pag-ihap ang unang adlaw sa ila ang incubation period ani, Doc?
From the last contact sa positive patient. Last contact kay kuan man na like for example karong adlaw nag-contact kaniya nya ang imong last sa kuan di ay sa Friday, so ato ka magsugod dito ihap sa last day of contact gyud. Dili katong first contact.
So the medical workers that came into contact with this patient since he was admitted in both hospitals are now also under
Yes,
quarantine?
they are already under quarantine sa ilang hospitals.
They know the protocol actually.
Yes, I know. And you mentioned something about the lack of PPEs, like we don't have hazmat.
Yes, that
Wala
actually
dito?
what kuan kay because of the kuan kaning panic buying unang narot-hurot yun ang mga kuan. That's why the DOH advises nga kung ang mag-wear lang yun og mask are those having influenza like illness, and para naapatay mahabilin para sa atong mga health workers nga sila jud pinaka-importante nga dapat mo gamit ana, especially sa hospital o katong mag-monitor sa atong mga PUMs.
So for in a worst case scenario like hazmats or hazardous material suits, we don't have that also.
Here right now murag wala, no, we don't have that one here.
Okay. So any more?
When will be our
Next
meeting?
press con tomorrow
I
afternoon
Um,
after the meeting with the hospitals probably.
Yes, we will just call for I will make the advisory actually.
Yeah. So
For final words, we will hear from
Final
Doc
words, yeah.
Leland.
Sige.
Okay. Ang akong din gipanawagan sa atong mga kaigsuonan sa Negros Oriental, number 1 is don't panic, no? Di kita mo panic as what we have done before, nga dili ta mo panic, and we will not entertain fake news nga gibutang gipost sa Facebook. Because the provincial government is always letting people know, no? Magsige tag press con para makabalo sila. Kay mao man ay gusto sa atong gobernador. Number 3 is if ever katong mga i-contact trace nato, please submit, no? Ayaw gid mo pagduha-duha because that is for the good of everybody, no? Sa inyo ha, of course, and for everybody. Dayon kinahanglan gid ta nga kung mag-contact trace ta, you are assured of confidentiality or the Privacy Act. Amo ginang gi-keep sa among kaugalingon. We will not reveal, no, kung kinsa mo. The most important thing is ma-reach out mo na mo because we want to help you. So, and then, do not forget the universal precaution, washing of hands, use alcohol. Then use PPAs whenever you have a respiratory infection. And then, do not eat healthy foods. Avoid, of course, na naman ay iwan sa governor.
Eat healthy foods. Yung
Ano ko sabihin? Sorry, eat healthy food. Sorry. Eat healthy foods. And then cook your own food. Do not buy food outside. Cook your own food.
Stay away from large
Stay away
crowds.
from, basta healthy foods. And then, kinanglan mo, katong na may gi-issue ang atong gobernador na avoid going to crowded places kung dili gyud importante. That's all.
Baso ka po ka
Any more?
Taga-asa ka siya, Dok?
Secret.
Thank you very much. We'll call for another press briefing tomorrow.
Okay.
Salamat.
Thank you. Thanks, Bim, ha?
Okay.
Alright.
Uy, ang among hotline, padayon na gyapon na until 9.